Hello guys, welcome to Physio Tutor Lab. So our today's topic from electrotherapy is hydrocollator pack or hot pack. But before starting the video, if you are new to my channel, please make sure to subscribe, share and like the video. Now, the modality used in hydrocollator pack is this whole unit. It is known as hydrocollator unit. Now it have various parts. We will study it one by one. The first is the lid or cover, which is used to retain the heat the modality will produce. Next is the wheels. The wheels are used to mobilize the unit from one place to another. Next is the switch here, which is the on off switch, which will help to start and turn off the machine. Next is the indicator, which will show that is the machine on or off. Now this thing here is the most important thing of this modality. It is known as thermostat. So what is thermostat? It will help to achieve our target temperature and help to maintain the temperature throughout the treatment process. Now next is this small indicator here, which will again show whether our thermostat is on or off. Now this is the tap attached to the hydrocollator unit. The tap is used to remove the excess water or the water after using the unit. Now this is a pair of tongs. The tong is used to pick the hot packs from the unit. Now these are the commercial hot packs, which can be hot or cold according to the modality we will use to store it. If we keep it in hydrocollator unit, it will become hot, and if we will freeze it, it will become cold. Same these two. It have a gel inside it which changes according to the temperature, but we won't be using this in the hydrocollator unit. We have another one which is something like this. Okay, it also come in various size and shape according to the joint or the contour of the body part we will be treating. Now first let's study about this hydrocollator pack. These are the commercial hot packs which are available in various form, as I told you earlier. Now what is the material of this? It is made from bentonite. Inside these packets there is a bentonite silicate gel which is hydrophilic in nature. Now it is covered with a canvas outer layer. So this white color thing which you are able to see is the canvas outer layer. Inside it you will find bentonite, which is a hydrophilic silicate gel which will store the water in it and retain the heat inside it. Now what is the reason of using bentonite? As I told you, it will hold a large quantity of water and allow efficient heat delivery. Now the fabric contains multiple pockets, as you can see in this picture. This is the one pocket, this is another pocket, this is a third pocket. Now why these pockets are made? The pockets are filled with gel, and this compartment make the pack flexible according to the body contouring. Okay, now what are the sizes of the packs? Packs come in different sizes and different shapes according to the body part. Now how we have to store these packs? The water which we will be using should be at 75 degree to 80 degree to make this hot pack warm. Now what is the heating equipment? The stored in hot pack tank with an electric heater. Now the modality which we saw here, this the hydrocollator unit, this have a wire here inside it, like something like this, which gets heated up, and here is the water we will be pouring. Now this wire just get heated electrically and makes the water warm. So what is the heating time? So if we are using the hot pack, putting it in a cold water, so it should be heated for at least 2 hours. But if we are reusing the hot pack in between the treatment, then it should be reheated within 30 minutes. Now, the tank is such designed in a way that there is a rack inside the tank on which we are keeping the hot packs. So, it will allow proper water circulation and the hot pack will be heated up faster and evenly. Now, as I told you, the hot pack come in various sizes. So this is the standard hot pack which is used for small joint. This is the a bit larger than the standard which is used for low back or upper back. And this is the larger one than this which is used for the entire back. This is a knee hot pack or shoulder hot pack. This will cover the contour part. Okay. And this is the oversize which we will be using to cover a body surface which is very large or to cover the major joints of the body. This is specially used for neck, and this is a half size hot pack which we'll be using for small joints like wrist or ankle joint. Okay. Now, as I told you, there are racks inside the hot pack unit, something like this, where we keep the hot pack. And there is a water inside it which will get heated. And these are the tongs used to pick the hot packs as it is very much warm. Now, what is the technique of application of hot pack? First, it will consist of preparation of apparatus. So, we will select the appropriate hot pack size based on the body part to be treated. For example, if we want to treat the knee, we will use the knee hot pack. If we want to treat small joints like ankle or wrist, we will use the half kg hot pack, etc. Now, we will place the pack in the hydrocollator tank and allow it to heat to the required temperature. Now, the selected towel of a proper size is to be folded in 4 to 8 layers between the pack and the skin. So there should be at least 4 to 8 layers between the skin and the pack. So when we want less heat, we will use more layers and vice versa. Now, what is the purpose of the towel? It will help maintain the skin temperature around 42 degrees Celsius even though the pack temperature is 75 degrees Celsius. So it will avoid overheating and prevent burns to the patient. Now, this is achieved due to thermal insulation of air trapped in the towel. So, as the water pack or the hot pack is wet due to water, it will leak, right? So, we will use a plastic sheet between the towel and the wet pack. Now, we will also prevent the towel from absorbing the water by using the plastic sheet. And all this will improve insulation so the heat will not lose or there will be no loss of heat and the heat will be retained inside the hot pack and the towels. Now this was the preparation of apparatus. Now we will talk about preparation of patient. So these all things come under the preparation of patient. First is explain the treatment to the patient. Now we have to explain the patient about the treatment or the procedure we will be performing before applying the modality to the patient. And make sure to expose or undress the part to be treated. Also, you have to remove the jewelry from the treatment area. And before applying the hot pack, make sure to check the thermal sensation of the patient's skin and rule out the contraindications. Position should be comfortable with the part required to be treated in therapeutic position. The position should not be uncomfortable to the patient, as he have to wait in the same position for next 20 to 30 minutes, so it should be comfortable for the patient. Now next comes is the application of the hot pack. First is to remove the gel pack from the tank using tongs, as I showed you in the picture earlier. Now shake off the excess water from the pack, as we don't want to leak the drops of water on the patient's body. Okay. So next is use a plastic sheet or dry towel around the pack to insulate it and retain the maximum heat we can. Now how I will do it? By wrapping the towel in 4 to 8 layers between the pack and the skin, as we require to maintain the temperature. Now next is place the pack on the treatment area and secure with a strap if required to keep it in a place. Like suppose, for example, we have to treat the shoulder joint, and if the patient position is sitting, then we can use a mulligan belt to secure the hot pack. Now next is give the patient a belt or a bell or a call device to report for any discomfort. Now if the patient is in the position for next 20 to 30 minutes, now how it will call you? So for that you have to give the patient a bell or a call device, so if he feel or any kind of discomfort, then he can just make noise using it and call you. Now the treatment of duration will be 20 to 30 minutes. So this is how we place the hot packs using towels on the part to be treated. Here they are treating the back. Now next is the precaution we have to take during the hot pack treatment. Now first we have to instruct the patient that not to sleep during the treatment, even though the therapy is sedative or relaxing. Okay, now this is to avoid excessive heat if patient feel, and it may cause burn, so we have to instruct the patient that they don't have to sleep during the treatment. Also we have to ensure the patient is well hydrated before starting the treatment. Why? Because this can cause sweating, and sweating may cause dehydration to the patient. Also we have to ask the patient if they are comfortable with the weight of the hot pack or not. As it get wet, it will gain more weight. Also, we have to tell the patient not to move once the pack is applied and maintain proper position and prevent burns. Also, we have to ask the patient immediately to inform if they feel any kind of excessive heat, burning sensation, or discomfort to avoid the risk of burns. Now, what are the things we have to take care of after the treatment? First, we have to remove the hot pack. Then, we have to inspect the skin area where we applied the hot pack for any kind of abnormal reactions. What is the normal reactions? Mild redness, which is arrhythmia, is common, and warm sensation, which is obvious. And allow the patient to be in supine for few minutes, then on sideline, and later ask them to get up slowly to avoid what? To avoid postural hypotension. Okay, we don't have to ask the patient to get up suddenly. Now, after getting up, we don't have to send the patient home directly. We have to ask them first whether they are okay or not, whether their pain is reduced or not, are they feeling dizzy or not. Now, next is the effect and uses of hot pack. What is the first thing? Effect on muscular spasm. The most important physiological effect of hot pack is rapid relief or muscle spasm. Most hot pack from hydrocollator pack is used in reducing muscle tension. Why? Because it will improve blood flow, reduce spindle sensitivity, and contribute to spasm relaxation. Second is local rise in temperature. Hot pack cause a local increase in tissue temperature, Heat is transferred by conduction from the pack to the skin and superficial tissue. Heat increased temperature leads to circulation increase, reduce muscle spasm and reduce pain. Now the third one is increase in local circulation. Heating will cause local vasodilation which will increase blood flow at the treatment site. Fresh blood will bring oxygen and nutrition to the tissue. It will also enhance circulation by removal of metabolic waste product. Next is effect on skin and connective tissue. The skin will become soft and more supple. Elasticity of connective tissue will increase, especially when combined with stretching. So you don't have to just apply the hot pack, you have to also give them stretching to increase the extensibility, okay, and elasticity of the connective tissue. And it is also useful in improving the flexibility, as I told you, in the stiff joints and tight soft tissue. Next is relief of pain. Hot pack will help in pain reduction. Pain relief may be due to slow nerve conduction velocity or increased pain threshold, and it will also cause sedative effect of heat. There will be counter irritation effect also, and pain reduction is also associated with reducing muscle spasm or increase joint range of motion. Now, next is the physiological effect of hot packs. First is local rise in temperature. It is done by conduction, increased temperature of the skin and superficial tissue. Next is vasodilation and increased blood circulation. Local vasodilation improves blood flow, which will bring more oxygen and nutrition, and it will also helpful in removal of metabolic waste. Next is reduction of muscle spasm. Moist heat relaxes muscle fiber and it will decrease gamma efferent activity and reduce muscle spindle sensitivity. Next is decreased in joint and soft tissue stiffness. Heat will increase the extensibility of the collagen fibers, improves flexibility when combined with stretching. Next is pain relief or analgesic effect. This will happen due to increased pain threshold. The pain threshold will be increased, okay, and decrease conduction velocity of the nerve. That is, the pain conduction velocity of the nerve will decrease. It will also show counter current effect and sedative effect and reduce spasm and contribute to pain relief. Next is increased local metabolism. Now, if we increase the temperature, that is higher temperature, this will cause increased enzyme activity and it will accelerate healing process in chronic condition. This is known as the Hoffman's law. It will also increase the sweating by promoting perspiration, which will help in detoxification and cooling. It will also decrease the viscosity of tissue fluid. Heat reduces viscosity of the synovial fluid and causes smoother joint movement. It will also improve connective tissue elasticity and make it more pliable, and it is useful before giving stretching or mobilization technique. It will also show sedative or relaxing effect, general relaxation of the body and mind, and decrease tension and promotes comfort. Now, we will talk about the contraindications of hot pack. First is lack of thermal sensation. Now, we have to check the thermal sensation of the patient with the test tube with hot water and cold water before starting the treatment. But the patient who cannot feel heat, we can't give hot pack to them because there are high risk of burns. Also, impaired circulation. If the peripheral vascular disease or severe varicose vein or atrial insufficiency is there in patient, we can't give them the hot pack. Next is acute inflammation. condition like heat, redness, swelling, we won't be giving the hot packs as it will worsen the syndrome. That means we can only use it in the chronic condition. Now, acute trauma or recent injury in the first 24 to 48 hours, like sprain, strain, what will they do? They will increase the bleeding by vasodilation. In hemorrhagic condition also we can't apply hot packs where bleeding is active. Okay, so this will cause loss of blood. In malignancy, in treatment area, heat will increase the metabolic activity, as I told you, due to Hoffman's law, and the blood flow, which will cause more blood loss. Next is open wounds, skin infection, or dermatitis. Now, we can place our hot pack over any infected skin or dermal condition, as we have to use it on other patients also, and we don't want the spread of infections and risk of irritations to other patients, so we will avoid it. Fever and systemic infection. Heat may increase body temperature further, and severe edema of unknown origin. This may worsen swelling. Overesthemic skin or area with decreased nutrition. Poor tissue viability increase burn of risk. Tissue viability increases risk of burn. Over metal implants, we won't be applying hot packs or superficially metal implants, as metal conduct heat, and this can be risk of overheating tissue. Over anesthetic skin, as it will act as a loss of sensation, and the patient will be unable to tell you whether it is feeling hot or cold, and unable to report you the overheating. Patient unable to communicate properly, unconscious, confused, or very young children, we don't place the hot pack as they can't communicate whether they are feeling hot or less warm or more warm properly. And pregnancy, over abdomen or low back, as heating is not that advised, but we can do it with a precaution. Now, next is dangers of hot pack. Now, what are the dangers of hot pack? First is burn, which is the most common danger. It can occur due to excessive heat, inadequate towel layer, faulty sensation, or prolonged treatment. Next is skin irritation or dermatitis, as we talked about it earlier also. It can develop redness, itchiness, or allergic condition. Next is fainting or giddiness. This can happen due to peripheral vasodilation, and it causes sudden drop in blood pressure, and especially in hydrated or weak patient, dehydrated or weak patients. Increased swelling and edema. Heat causes vasodilation. It further can worsen edema and acute injury or circulatory problems, bleeding or hematoma aggravation. Heat can increase bleeding in condition with active hemorrhage or fresh trauma. Next is overheating of metallic implants. If superficial metals like plate, screw, or any jewelry is present, can cause localized burn, skin damage in patients with impaired sensation. Diabetic neuropathy or spinal cord injury patients are at higher risk because they cannot detect excessive heat. Next is infection spread. Heat may worsen local infection by increasing blood vessel flow, and metabolic activity. Next is hypotension. Prolonged heat can cause excessive vasodilation, and it will drop in blood pressure, causing dizziness, which is postural hypotension. Next is dehydration. Excessive sweating without hydration can cause fatigue, dizziness, and electrolyte balance. So we have to instruct the patient to have a lot of water or be dehydrated before the treatment. Next is increased pain. If applied in acute inflammatory condition, heat may intensify pain and inflammation. So we will not use it in any type of acute condition. We will only use it in chronic conditions. So this is all about the hot pack. If you like my video, please share and subscribe, and also comment in the comment box how you liked the video. And also, if you want any other topic to be explained, please mention it in the comment section. So